So this is my project on inflammatory bowel disease, and I'm in period 1, so that's the introduction. So what is inflammatory bowel disease? It's described as a chronic long-lasting irritation of the gastrointestinal tract, and it's actually under two different um I guess types. There's Crohn's disease and ulcerative colitis, and as you could see by this picture that's in the image or in the slide, you could see that your ulcerative colitis only affects the rectum, and then the Crohn's disease, it affects pretty much every part of the gastrointestinal tract. And then to continue, the causes of inflammatory bowel disease, it's mainly these are some of the reasons why. There's no specific reason, but the things that sometimes cause it are weakened immune system, or an overreaction of the immune system, or genetic factors, but overall the main factor is unknown. And the weakened immune system, this could be because there's a virus or bacteria that's in your GI tract, and it's causing this inflammation, or because it's an autoimmune response that ends up attacking parts of your gastrointestinal tract. And then it could just be genetic factors. So yeah. And then risk factors of inflammatory bowel disease, it can be age, history of inflammatory bowel disease in your family, your race or ethnicity, and more specifically, if you're white, you're more likely to have inflammatory bowel disease. And then if you're an active smoker, or if you're a drug user, those are also risk factors. And then another one is prescription medication. That can also be a cause or a risk factor. And then the anatomy of inflammatory bowel disease, it affects the inner lining of the GI tract. The colon is most often affected, so in most cases the colon is always going to be affected. And then Crohn's disease affects the entire GI tract, while ulcerative colitis only affects the colon. And then signs and symptoms of inflammatory bowel disease, it's diarrhea, fatigue, pain and cramping of the abdomen, blood in your feces, and little to no appetite and weight loss. And there's you're probably not gonna experience every single one, but these are just some of the main symptoms of it. And then treatments for inflammatory bowel disease, medications, and mainly steroids, because they lower an immune response and help decrease inflammation of the GI tract. Or they could just do surgery to get rid of the parts of the intestines that are super inflamed. And that's the end of the presentation.